I'm Dr. Michael Winters, Winters Wellness Chiropractic Redefined, and I want to talk to you today about something that about 5% of the population has, so everybody's not familiar with it, but it's called spondylolisthesis. It's a big word. It refers to forward slippage of a vertebrae. And that forward slippage we're often born with, although we can get degenerative spondylolisthesis where arthritis causes the vertebra to slip forward. But for most of us, we're either born with it, or maybe we took a really hard fall on our butt as a child and it caused a stress fracture in this area of the spine, and there's a little separation there that allowed the vertebra to slip forward. The reason for this video is I met somebody last night who was going to have surgery for spondylolisthesis, and when I asked him a few questions I didn't get the answers that I was looking for. So I want to share some things with you to help possibly prevent you from having something like that done. I personally have spondylolisthesis, so if you want something fixed, go to somebody that has the problem and they'll know how to fix it. So what I want to share with you is some very important principles that I learned through my own body, of course, and through my chiropractic training. One is that since we were often born with this, or we developed it early in life, and then maybe we only start hurting in our 20s or our 30s or our 40s when we've had an accident or some chronic problems develop, that means that the problem isn't probably so much the spondylolisthesis, the forward slippage, as it is failure to adapt to the spondylolisthesis. Meaning, we've had this our entire life, it's just now that we can't adapt to it any longer. So I want to share with you 3 things that make a huge difference in adapting to spondylolisthesis. One is our upper neck. This upper neck has to be right, or there's going to be tension throughout the whole spinal cord. And I'm going to give you a picture, and we're looking at a side view here, and you have to pardon my rough drawing. But if I turn this way and look at this picture, for example, take my upper neck. If my head is like this, for example, I can't walk around the world looking at the world with my head cocked like that. I have to adapt so that I'm even. So my lower back is going to adapt to keep me right and square with the world. And so my lower back is going to be affected by my upper neck in a huge way. It's also going to cause tension throughout the spinal cord. The second area that's really important is this transitional area right here in your spine. The reason that that's so important is we have the spinal cord inside here, and that spinal cord comes down here, and just below this transitional area it ends, and it's just nerve roots hanging down there after that. Well, if this area of the spine is locked and not moving properly, it will change the angle of these nerve roots and pull those nerve roots up where they're going to cause problems. And so again, it's not so much having the spondylolisthesis that we might have had our entire life, it's the fact that this area is locked up, changing the angle of the nerves, and then they're pulling up tight and causing us a problem. And when that's the situation, we can get physical therapy, which is great. We need to strengthen our abdominals. That's a very important part of the problem. And we're not anti-physical therapists. We work with physical therapists on certain things. But physical therapy is not usually going to change what's going on here spine-wise in terms of what chiropractors refer to as the subluxation. So chiropractic adjustments in this area can be a huge help with spondylolisthesis. A third thing is we might need to take tension off the spinal cord, because there's something that comes down here and attaches at the little coccyx bone called the filum terminale. That filum terminale, when this little coccyx is off balance, it'll create tension on the spinal cord. So if this is your brain, this is your spinal cord, and there's problems down there, even at the coccyx, that'll cause more tension there, and that'll make more pain at this spondylolisthesis area that you might have had your entire life. So that's actually 3 areas that can hugely affect spondylolisthesis: our upper neck, this transitional area about T12L1 in the spine, and the coccyx. Now the last thing is, and this is usually just icing on the cake to finish the correction, is it only takes micrometer pressure on the nerve, about the weight of a dime pressure on a nerve, to cause problems. So there's not a chiropractic adjustment that's going to shift this a lot, and there's 4 grades to this. If this is this far, 1/4 of the way forward, it's grade 1. If it's halfway forward, it's grade 2. If it's 3/4 forward, it's grade 3. If it's in this last section, it's grade 4. Most people are grade 1 or 2. Grant you, there might be some people that are 3 or 4 through various crazy stuff or really severe accidents, and maybe the person could have to need surgery, but I'm saying probably 1 out of 1,000 would need any kind of surgery at grade 1 or 2. Even less than that. It should be reserved for those higher grades. So, problems there can cause an issue, problems there can cause an issue, problems there can cause an issue, and the icing on the cake is to just nudge this a little bit to take pressure off the nerve. One of the ways that we do that in our office is with this arthrostim instrument. We actually go through the abdomen at the level of 5th lumbar, which is right there, and tap that. Now that's just vibrational energy, but again, enough vibration will get through the soft tissues that will just take that micrometer pressure off, like just taking a dime off the nerve to relieve that. And so we have tremendous success with spondylolisthesis. I've been in practice 31 years. I've never seen a patient that had to go to surgery for spondylolisthesis. Now, again, there could be the rare exceptions if people are grade 3 or 4, but anybody that's considering surgery for spondylolisthesis or just has that problem in general really needs to make sure that the upper neck is right so that the low back is not adapting to what's going on in the upper neck. They need to make sure that they're unlocked and moving freely in this transitional area of the spine. They need to make sure that the little coccyx bone is not pulling tension on the entire spinal cord, and they need to make sure that we've taken whatever pressure off anteriorly that we can to take pressure off that nerve. So that's a segment on spondylolisthesis. If you know somebody that has that problem, make sure they watch this video. Again, Dr. Michael Winters, Winters Wellness, Chiropractic Redefined. Subscribe to us on YouTube or like us on Facebook. Thanks.